If you keep getting priority questions wrong, you will fail the Nclex. Not because you don't know the content, but because you don't know how to think like the Nclex. In this video, I'm giving you 50 Nclex priority questions you must master, the exact type that test airway versus breathing versus circulation, stable versus unstable, acute versus chronic, expected versus unexpected. If you can master these, you can pass this exam. Pause the video, answer before I explain. Train your brain to prioritize like a nurse. Let's begin. 1. The nurse receives report on 4 clients. Which client should be assessed first? A. COPD client with O2 sat 90% on 2-liter NC. B. Post-op client reporting pain 8 out of 10. C. Asthma client with no wheezing and minimal air movement. D. Client with UTI and fever 101 degrees Fahrenheit. Correct answer? C. Rationale? Minimal air movement indicates impending respiratory failure. Airway is priority. 2. A post-thyroidectomy client reports difficulty breathing. What is the priority action? A. Elevate HOB. B. Check incision. C. Assess for stridor. D. Administer pain medication. Correct answer? C. Rationale? Stridor indicates airway obstruction from swelling or hematoma. 3. Which laboratory value requires immediate intervention? A. Potassium 6.2 milliequivalents per liter. B. Sodium 148 milliequivalents per liter. C. Hemoglobin 10 grams per deciliter. D. Glucose 160 milligrams per deciliter. Correct answer? A. Rationale? Severe hyperkalemia can cause fatal dysrhythmias. 4. Which client is most unstable? A. BP 84/50 after GI bleed. B. Chronic anemia. C. Migraine headache. D. Controlled atrial fibrillation. Correct answer? A. Rationale? Hypotension plus active bleed equals hypovolemic shock. 5. A client with diabetes has a blood glucose of 48 milligrams per deciliter. What is the priority? A. Recheck in 1 hour. B. Give insulin. C. Administer fast-acting carbohydrate. D. Encourage ambulation. Correct answer? C. Rationale? Hypoglycemia threatens brain function. 6. After a thoracentesis, which finding is priority? A. Cough. B. Pain at site. C. Tracheal deviation. D. Mild crackles. Correct answer? C. Rationale? Tracheal deviation indicates tension pneumothorax. 7. Which post-operative finding requires immediate action? A. Urine output 20 milliliters per hour. B. Temp 100.4 degrees Fahrenheit. C. Pain 7/10. D. Nausea. Correct answer? A. Rationale? Low urine output indicates decreased perfusion. 8. Which burn client requires immediate assessment? A. Partial thickness burns on arms. B. Facial burns with hoarseness. C. Pain score 9/10. D. Blisters on legs. Correct answer? B. Rationale? Hoarseness suggests airway edema. 9. A client receiving blood develops back pain and chills. What is the priority? A. Slow infusion. B. Stop transfusion. C. Give acetaminophen. D. Document reaction. Correct answer? B. Rationale? Back pain suggests hemolytic reaction. 10. Which stroke client should be seen first? A. Onset 30 minutes ago. B. Stroke 2 days ago. C. History of TIA. D. Residual weakness. Correct answer, A. Rationale, early treatment window for thrombolytics. 11. New confusion in elderly client. What is the priority? A. Reorient. B. Check oxygen saturation. C. Call provider. D. Apply restraints. Correct answer, B. Rationale, hypoxia commonly causes acute confusion. 12. Client with chest pain and ST elevation. What is the priority? A. Administer morphine. B. Obtain consent. C. Activate emergency response. D. Reassess in 30 minutes. Correct answer, C. Rationale, STEMI requires immediate intervention. 13. Which electrolyte imbalance is most dangerous? A. Calcium 8.6. B. Potassium 2.8. C. Sodium 145. D. Magnesium 1.9. Correct answer, B. Rationale, hypokalemia increases arrhythmia risk. 14. A pre-eclamptic client reports headache and visual changes. Priority, A. Check urine. B. Reduce stimuli. C. Prepare magnesium sulfate. D. Recheck BP. Correct answer, C. Rationale, signs of impending seizure. 15. A client with sepsis has lactate 5 millimoles per liter. Priority, A. Start antibiotics. B. Administer IV fluids. C. Draw cultures. D. Monitor temperature. Correct answer, B. Rationale, fluid resuscitation improves perfusion. 16. Compartment syndrome earliest sign. A. Pallor. B. Paralysis. C. Pain unrelieved by medication. D. Pulselessness. Correct answer, C. Rationale, severe pain is earliest indicator. 17. A child post-tonsillectomy is swallowing frequently. Priority, A. Offer ice chips. B. Inspect throat. C. Suspect bleeding. D. Reposition. Correct answer, C. Rationale, frequent swallowing suggests hemorrhage. 18. Which asthma finding is most concerning? A. Wheezing. B. Tachypnea. C. Silent chest. D. Cough. Correct answer, C. Rationale, no airflow indicates severe obstruction. 19. A suicidal client with a specific plan. Priority, A. One-to-one observation. B. Encourage journaling. C. Family visit. D. Group therapy. Correct answer, A. Rationale, safety first. 20. New tracheostomy becomes dislodged. Priority, A. Call provider. B. Insert new trach. C. Bag mask ventilate. D. Document. Correct answer, C. Airway must be maintained immediately. 21. Hyperkalemia with peaked T waves. Priority medication? A. Insulin. B. Calcium gluconate. C. Kayexalate. D. Furosemide. Answer, B. Rationale, stabilizes cardiac membrane. 22. Suspected epiglottitis. Priority, A. Inspect throat. B. Throat culture. C. Prepare for airway support. D. Give fluids. Answer, C. Rationale, airway obstruction risk. 24. Anaphylaxis. First action, A. Oxygen. B. IV fluids. C. Epinephrine IM. D. antihistamine. Answer C. Rationale: reverses airway swelling. 24. Increased ICP earliest sign. A. Bradycardia. B. Vomiting. C. Decreased LOC. D. Hypertension. Answer C. Rationale: LOC change is earliest. 25. Pulmonary embolism suspected. First action: A. Ambulate. B. Oxygen. C. Morphine. D. Heparin. Answer B. Rationale: correct hypoxia first. 26. Addisonian crisis. Priority: A. Insulin. B. IV hydrocortisone. C. Diuretics. D. Fluid restriction. Answer B. Rationale: replace cortisol. 27. DKA priority. A. Insulin. B. IV fluids. C. Potassium. D. Bicarbonate. Answer B. Rationale: restore volume first. 28. Magnesium toxicity sign. A. Hyperreflexia. B. Respiratory depression. C. Hypertension. D. Tachycardia. Answer B. Rationale: respiratory suppression. 29. Neutropenic fever. Priority: A. Isolation. B. Antibiotics. C. Antipyretic. D. Fluids. Answer B. Rationale: prevent sepsis. 30. Tension pneumothorax. Treatment: A. Chest X-ray. B. Oxygen. C. Needle decompression. D. Antibiotics. Answer C. Rationale: immediate pressure release. 31. Hypocalcemia sign. A. Bradycardia. B. Tetany. C. Constipation. D. Lethargy. Answer B. Rationale: neuromuscular irritability. 32. Narcotic overdose. Antidote: A. Flumazenil. B. Naloxone. C. Atropine. D. Epinephrine. Answer B. Rationale: reverses opioids. 33. Symptomatic bradycardia. Priority: A. CPR. B. Atropine. C. Defibrillation. D. Adenosine. Answer B. Rationale: first-line drug. 34. Post-cardiac cath bleeding. Action: A. Elevate leg. B. Apply pressure. C. Ice. D. Ambulate. Answer B. Rationale: prevent hemorrhage. 35. Eclampsia seizure. Priority: A. Oxygen. B. Magnesium sulfate. C. Diazepam. D. Fluids. Answer B. Rationale: prevent further seizures. 36. Spinal shock hypotension. Treatment: A. Diuretics. B. Vasopressors. C. Sedation. D. Fluid restriction. Answer B. Rationale: support perfusion. 37. Hypovolemic shock. Priority: A. Blood cultures. B. Rapid IV fluids. C. Antibiotics. D. Vasodilators. Answer B. Rationale: restore volume. 38. Thyroid storm. Priority: A. Cooling measures. B. Antibiotics. C. Sedatives. D. Insulin. Answer A. Rationale: control hyperthermia. 39. Post-thyroidectomy tetany. Action: A. Oxygen. B. Calcium gluconate. C. Insulin. D. Potassium. Answer B. Rationale, treat hypocalcemia. 40. Acute hemothorax. Priority: A. Oxygen, B. Chest tube, C. Antibiotics, D. CT scan. Answer B. Rationale, drain blood. 41. Severe asthma attack. First line: A. Steroids, B. Nebulized bronchodilator, C. Antibiotics, D. Sedatives. Answer B. Rationale, open airway. 42. Stroke hemorrhagic. Priority: A. Aspirin, B. Lower BP, C. TPA, D. Heparin. Answer B. Rationale, prevent rebleeding. 43. Infant cyanotic. Priority: A. Feed, B. Airway positioning, C. Weigh, D. Bathe. Answer B. Rationale, ensure oxygenation. 44. Acute laryngospasm. Priority: A. Section, B. Positive pressure ventilation, C. Fluids, D. Antihistamine. Answer B. Rationale, restore airflow. 45. Client with new onset atrial fibrillation and hypotension. Priority: A. Monitor, B. Cardioversion, C. Aspirin, D. Ambulate. Answer B. Rationale, unstable rhythm requires immediate intervention. 46. Severe hypothermia. Priority: A. Rapid rewarming, B. Gentle handling, C. CPR, D. Ice packs. Answer B. Rationale, prevent arrhythmias. 47. Acute GI bleed. First action: A. Insert NG tube, B. IV access, C. Endoscopy, D. Oral fluids. Answer B. Rationale, prepare for fluid/blood replacement. 48. Child with croup and stridor at rest. Priority: A. Cool mist, B. Racemic epinephrine, C. Antibiotics, D. Cough syrup. Answer B. Rationale, reduces airway swelling. 49. Post-op restless and O2 sat 88%. Priority: A. Pain meds, B. Airway assessment, C. Ambulate, D. Reassure. Answer B. Rationale, hypoxia causes restlessness. 50. Acute chest trauma with absent breath sounds on one side. Priority: A. X-ray, B. Oxygen, C. Needle decompression, D. Pain medication. Answer C. Rationale, suspected tension pneumothorax. If you struggled with these questions, that's good. It means you're identifying your weak areas before the exam does. Priority questions are not about memorization. They're about clinical judgment. If you want more high-level Nclex strategy content like this, subscribe to Road to Nursing License 101. Like this video. Comment Part 2 if you want a harder priority edition. Remember, the Nclex does not test what you know. It tests how you think. Train your thinking, and you will pass. I'll see you in the next one.